Welcome, everyone, to today's Spotlight on Inflammatory Breast Cancer led by Dr. Lintz. This program is hosted by the Blum Resource Center. Over at the Blum, we are grateful to Dr. Lintz for joining us here today. The recording of this session will be posted on our Blum YouTube playlist and our Blum Digital Resource Center. If you have any questions or would like more information about resources and programs offered through the Blum, please visit our website at www.dana-farber.org/resource center or email us at blum_center@dfci.harvard.edu. Thank you all for joining us. I will now pass the spotlight over to Dr. Lintz.
Hi, everyone. Thank you for having me here today. I am delighted to spend the next few minutes talking to you about our Dana-Farber Inflammatory Breast Cancer Program. My name is Felipa Lintz. I am a breast medical oncologist, and I am the director of the Dana-Farber Inflammatory Breast Cancer Program. And before we get started, I wanted to tell you a little bit about what is inflammatory breast cancer. So inflammatory breast cancer is a rare but aggressive form of breast cancer. And unlike most breast cancers, which are detected by a mass or a lump in the breast, inflammatory breast cancer, or also commonly named IBC, is diagnosed by clinical history and the findings on exam after a biopsy confirming the diagnosis of invasive breast cancer. Often, there's not a mass or there's not an abnormality on the screening mammogram. But the typical case is someone that comes to the office and says, I notice this redness in my breast, or these skin changes, or my breast feels much heavier. Often patients are told that they have a mastitis or an infection of the breasts. They are given antibiotics before actually a diagnosis of inflammatory breast cancer is made. Other characteristic of this disease is the onset of the disease is rapid. So the patients can clearly tell us, oh, my breast looked just fine a month ago. So this all started very quickly, often over the course of just a few weeks. And you can see here in this cartoon some examples of how breast cancer, inflammatory breast cancer, can present. So here at Dana-Farber, we design our IBC program to provide multidisciplinary approach to patient care, to patients diagnosed with inflammatory breast cancer, to optimize diagnostic criteria and treatment strategies that includes systemic therapy, and this can be chemotherapy, endocrine therapy, or targeted therapies, best surgical techniques, and radiation therapy for patients with inflammatory breast cancer. The program was also designed to develop inflammatory breast cancer dedicated clinical trials so that we can continue to move forward the field of IBC, to provide support and education to patients and providers, and to provide biologic materials to advance the knowledge of the disease and enhance treatment options. And in the next few slides, I'll show you how we are trying to achieve all these important goals. So here are the 4 pillars of the IBC program that we based on these pillars to try to achieve our mission that I just told you about in the prior slides. And we base our program on these very important 4 pillars. So let's get started with clinical care. We aim to provide excellent medical care with our multidisciplinary team to all and every single patient that we see at our institution with inflammatory breast cancer. In addition to that, we also help with coordination of non-medical appointments through our either at our ZAKIM Center or with our excellent social workers. And we also increase accessibility to Dana-Farber resources that include financial assistance, caretaker resources, transportation resources, just to name a few. Monthly, we conduct IBC support groups And this is something unique of our program, as the support groups are held just for patients that are diagnosed or have been diagnosed in the past with inflammatory breast cancer, so creates a very unique atmosphere. This is led by our social worker, Jess Mosey, and approximately 3 times a year, these meetings, in addition to providing IBC social support, they also include education, topics that we find that are of relevance to our patients with IBC, and they are often defined and chosen by our IBC patients as well. Another important pillar of our program is to provide education to patients and their loved ones. To achieve this goal, we have a yearly patient forum that is almost 1 day long of virtual education sessions. We also have biannual newsletters, and we provide with an IBC binder, both in paper and virtual formats, to all our patients. In terms of research, we are proud to offer IBC-specific clinical trials to our patients. We have an IBC registry where we continue to learn about IBC, but also it allows our teams to recontact our patients for potential future research studies, and whenever there are opportunities, either research or education, that we feel that can be of interest to our patients. And we also have a metastatic IBC registry that we offer participation to our patients that meet criteria. So we also have fundraising activities, and the most important one is our Jimmy Fund Walk that happens every year, where our team comes together to walk to fundraise to move forward the field of IBC. And we are so fortunate to have so many patients that partner with us, patients and providers that partner with us to continue to achieve our mission. So here are some contacts that might be of interest to you if you want to learn more about the IBC program. It includes the contacts of our IBC program administrator, Marisa Powell. We look forward to hear from you. Please reach out if you have any additional questions, if you want to become involved, or if you want to come for a second opinion, or to receive all your care here. Thank you for listening.
Thank you so much, Dr. Lentz, for this informative spotlight on inflammatory breast cancer. Please keep an eye out for more Blum Center spotlights in the future. Thank you so much.